Hello and welcome to the webinar on the very pressing and important topic in today's healthcare, cancer, and how to beat it, or at least how to effectively treat it. Mission Possible is today's main headline, and today's event is truly international and pan-European. The organizers are the Research Council of Lithuania, National Contact Points and Lithuanian RDI Liaison Office, LINO, in Brussels, and also the Estonian and Latvian RDI Liaison Offices in Brussels. My name is Neeme Raud. I'm Estonian journalist, and I will host today's meeting from Tallinn. Our speakers are all over Baltic States and Europe, so as I said, it's very pan-European today. Our event is first and foremost for the stakeholders who are planning to participate in the Horizon Europe Cancer Mission activities. And we have very high interest today. We have 139 participants registered from 11 European countries and also from Australia. Looking ahead now, for the next 2 hours, our guests from European Commission, Lithuanian, Latvian, and Estonian national authorities, cancer research institutions, startups, and NGOs will present the main aspects of cancer research under Horizon Europe funding program. The speakers will discuss today how they could contribute to the cancer mission and how to coordinate their implementation efforts at the regional level in the Baltic countries here. And to open our event, once more, the title is today, Conquering Cancer Mission Possible, not Mission Impossible, Mission Possible, Coordination of Actions in Baltic States. I'm pleased to introduce to you Ms. Annika Nowak, who is the head of Sector Cancer Mission Secretariat at the European Commission, DG Research and Innovation, the EU Mission on Cancer, and the Europe's Beating Cancer Plan is her topic. Ms. Nowak started at the European level working in 2001 already. She was in the European Parliament first, then moving on to the European Commission at 2004. And 2019, Ms. Nowak started to work at the Directorate General for Research and Innovation in the area of health research. And since July of this year, she's the head of sector of the cancer mission at the secretariat. So here is Ms. Annika Nowak.
Yes, hello. Thanks for the introduction. Hello, everybody. Hello from Brussels, my office. Yes, it's a pleasure to present you the EU mission on cancer, and how, what it all implies and what it includes, and how we go about to implement it. So, and with that, I would immediately jump into my presentation. Yes, so what are EU missions? I mean, that's a very important thing to understand that, I mean, first of all, they are a novelty under the Horizon Europe new program. So the program for 21 to 27. And the mission is a portfolio. It's a portfolio of actions across the disciplines, and they should intend to achieve bold, inspirational, and measurable goals within a set time frame, so by 2030. And they should have an impact for society and policy making, and also be relevant for a significant part of the European population and a wide range of citizens. So that sets the frame, and it's really important to have that in mind for all the activities we do. This is, what guides us, and which we should, develop and keep in mind over the years. So it constitutes in a way how we address some of the greatest challenges that we face, and it should support, other Commission priorities. Such the European Green Deal, or the 4 other missions are more about the Green Deal. You will see that. Europe Fit for the Digital Age, and obviously for the cancer mission, the Europe's Beating Cancer Plan, but also the new Bauhaus. With that, the next slide shows you the 5 missions we have. All of them were launched on the 29th of September. So we have climate, we have the cancer, we have smart cities, we have oceans, and soils. And all of them should deliver, have concrete and ambitious goals, and should deliver by 2030. So next slide. This gives you an overview what the cancer mission, together with the Europe's Beating plan, aims to achieve. So it's aiming at improving the lives of more than 3 million people by 2030 through actions on prevention, cure, and for those affected by cancer, including their families, to live longer and better. So that's the overall goal. And in reaching that goal, I mean, we have developed the mission to be based on 4 specific objectives. So understanding cancer, prevention, prevent, was it preventable, optimize cancer diagnosis and treatment, and improve the quality of life of cancer survivors, but also families. And these 4 specific objectives go also hand in hand with operational objectives, for instance, to address inequalities and access to knowledge, to research, to care throughout Europe. And also to understand what are the concrete actions, which I will present in a minute. I would advise you also to consult what we call the implementation plan of the cancer mission, which had been published on the 29th of September. And this implementation plan provides you a clear operational and feasible course of action. It also outlines the funding instruments, the synergies it should seek, and it provides a lot of details and the broader context in which the mission will operate. So next slide, please. So now for each of the objectives, we have developed, based on the recommendations we have received through the Cancer Mission Board in the past 2 years, recommendations which we then translated into actions which then could be implemented through the various EU instruments. So in the area of understanding, an improved understanding, obviously, of the development of cancer in the broadest possible sense will enable us to develop effective cancer prevention and screening programs, devices, diagnostic tests, as well as treatment and care solutions adapted to each patient. So examples of actions are, first of all, the establishment of the UNCAN platform, which should be then a unique digital platform where research from Europe and beyond can have access to research data in the broadest sense, so research health data. That's one of the actions we have launched already this year with the first Horizon Europe work program. But there's also other goals, and there will be in the area of understanding, for example, to determine the role of genetics in cancer. Next slide, please. So in the area of prevention, you see there are also quite some actions foreseen. All of them, I mean, it's a matter of implementing in the course of the next years. So prevention, including screening and early detection. So enhanced effective prevention measures and programs should help to exploit the potential of preventing 40% of cancers. Optimized screening and early detection programs would improve the coverage of the target population and benefit from screening, and so increase the detection of cancer at an early stage. And this obviously would then also allow starting adequate and in more cases less invasive treatments, increasing the chances of survival and improving the quality of life of people living with and after cancer. So examples in that area is development by 2025, a one-stop cancer information center on prevention, or also develop new methods and technologies for screening and early detection. Next slide, please. So in the area of diagnostic and treatment, it's very much coupled also with the principle of equitable access to ensure that more patients have access to the latest minimally invasive treatments adapted to their conditions. An example here, one of the major examples, which also was included in one of the first slides, will be the creation of a network of comprehensive cancer infrastructures by 25, an action which is also included in the Europe's Beating Cancer Plan, and that goes back to strong recommendations from the Cancer Mission Board. Next slide, please. So in the area of quality of life, the 4 objectives. So improved quality of life provides or requires a thorough analysis of all the key factors and needs of patients' life, and that would then help more people affected by cancer to live longer and better compared to today's situation. Again, here there are quite some ambitious activities proposed. The creation of a European Cancer Patient Digital Center to provide personalized care for cancer patients and survivors. Again, something the Cancer Mission Board has strongly recommended to do. And also the development of monitoring programs for survivors of childhood cancer. So these are just some of the actions. And again, for more details, I recommend you to consult the implementation plan. The next slide, please. As I said, I mean, missions that don't operate in isolation. They, by construction or by principle, they should seek synergies with EU policies, initiatives, as well as with national activities. So here again, you see a list which is not complete, because there are many related EU policies which can support and to the overall goal of the mission. Just to highlight a few is obviously, I mean, the Horizon Europe program, or the partnerships under the Horizon Europe program. There are a couple of partnerships like the new innovative health initiatives, or there's initiative on health system. So these are partnerships which are relevant to help implement the mission. But there are plenty of other existing. The European Cancer Information System will provide useful data. There are also initiatives in the environmental protection area, in the area of healthy lifestyle, so prevention. So you see there are many links, but also to broader activities like the European Health Data Space, under which the digital center should be placed on. And also the Knowledge Center on Cancer is a pillar of both the cancer plan and the mission to implement many of the activities and to support them. With that, I move on to another very important characteristic of the mission on cancer. So the implementation for both initiatives, which to a certain extent overlap, but to support each other and will be implemented or should be implemented in a consistent way, we have created what we call a joint governance. Joint governance which should help that integrated approach which both initiatives have taken, to make sure that the discussions we have with the member states, with the stakeholders, but also inside the Commission, are from day one really, across the policies. So here I want to highlight the dialogue we have with the member states. We have created what we call a joint subgroup on cancer, so where member states are represented, member states, delegates from the health ministries, as well as from the research ministries. They jointly follow the implementation of the cancer plan and the cancer mission. We also have the same approach for the dialogue with stakeholders. So there is a group, a stakeholder contact group under the EU Health Policy Platform, so a virtual platform which serves us then as a basis for discussion and exchanges through regular webinars. Just recently, in November, we had a huge webinar to kick off the work on the cancer mission, with more than 600 organizations attending. So please move on. What is also important, obviously, is to see what are the available funding programs and instruments beyond Horizon Europe. I mean, first of all, it is the Horizon Europe program, which will support the more R&I related actions to the cancer mission. And for the first 3 years, we have a minimum budget of 378 million, so the first 3 years. But there are also other parts of the Horizon Europe program which may and do support actions in the area of cancer, so it's the health cluster itself, but also there might be activities under the European Innovation Council and the European Research Council. In parallel, also the EU for Health program, the new EU for Health program has secured a considerable amount of funding to support the Euro-speaking cancer plan. And in total, it will be 1.25 billion until 2027. Other programs, so we have the Digital Euro program, also with 250 million for cancer-related activities until 2027. Next slide, please. Here you see also other programs, Erasmus, the technical support instrument, the cohesion funds. They can play a major role with the support of member states if they want to spend these monies to make investment into health infrastructures, training, and so on. So this is just to give you an overview. This is even not exhaustive again. What kind of financial instruments are available to investments into health, into cancer. And this is, I think, also one of the biggest tasks we have now to do as Commission to raise awareness on these activities, or these funding opportunities for member states, but also for others, and also to facilitate this discussion that the actions are spent or funded under this instrument. For the next steps, so next slide, please. Thank you. What we have done so far and what will be the next steps. So since the launch of the cancer mission end of September, we invested a lot into outreach activities. So really to present the mission as much as we can in national events such as today's event, with stakeholders and really to raise the awareness of that new instrument under Horizon Europe. We've started the dialogue with the member states, mainly through the subgroup on cancer, which I had presented shortly, and also with the stakeholders. In parallel, we also have launched calls under the Horizon Europe program. So a first program had been adopted, what the first program 21-22 had been adopted in mid of June, and it included already a set of actions to lay the ground. So in particular, what I said, the launch of the Uncan platform, Uncan EU platform. The second amendment, we call it amendment because we could only launch this once we had the final confirmation of the missions. A first amendment, so for 21, has been adopted only yesterday. So I invite you to look at the portal and to see what we have included under this program. And in parallel, again, we are already working on a second amendment to include actions for 22. So that's what we can do in terms of the Horizon Europe funding. But as I have explained earlier, there are lots of parallel calls and initiatives under the EU for Health program and also other programs. As one of the next steps in the beginning of next year, we will also select and create a new mission board, which will then advise the Commission on implementation aspects, because the current mission board, which has provided the recommendations and defined the scope and outline of the mission, its mandate has been expired just a week ago. So with that, I can finish my presentation. Next slide gives you the access to the documents I have cited. So what is clear, the fight against cancer is a top priority for the Commission, but the success obviously depends on each of us. So it has the potential to realize fundamental changes in the way research and health policy will address the cancer challenge through its unique approach. In a very complementary manner, each of the 4 mission objectives will contribute towards reaching the overall goal by reducing the number of new cases and improving survival rates and quality of life. And I'm really glad to see today's event and also the cross-country event, because we are all here in the Commission firmly convinced that only the continuous dialogue with the stakeholders is key for, delivering concrete results. And again, I encourage you to continue share with us activities and contribute to the actions in the part of research and innovation, which will be launched in the next years under the Commission on Cancer. Many thanks for your attention.
Thank you, Mrs. Nowak, head of sector of the Cancer Mission from European Commission. But I have also 3 questions from our audience here for you. So if you could take a little time to answer those questions. First is about citizens' engagement. Do you see that it would have an added value for the implementation of the missions? You also mentioned already that it's important to engage communities and societies.
Yes, indeed. And I could have highlighted even more. No, these are, citizens' engagement activities are and will be an important feature of the missions. We have seen when we, together with the Cancer Mission Board, developed the outline and shaped the recommendations. We had some very interesting citizens' engagement events last year over the summer. It was very little time, but they brought some very interesting results, which were then also taken into consideration by the board and to redefine some of the actions. But that shouldn't stop there. That's to really have impact. Impact, but also really to the benefit of citizens. We are now planning and redefining how they should be concretely looked at. It will be a mix of what we call online focus groups, so very specific interactions. We're also considering citizens panel as well as bigger events if the situation will allow that. But what is clear, it should happen in all member states, because that's where the citizens are, and not here having a nice event in Brussels. So that's what we're reflecting on. Thank you.
Second question, this is from our audience. As a researcher, I would love to know exactly what form this mission will become into, and when this mission will become into application rounds, when the actual applications rounds will start, and what the goals of these specific rounds will be.
Not sure I understand what exactly is meant. As I tried to explain, the implementation plan with the objectives takes a very comprehensive approach. So you will see, now with the work programs, at least as regards the research related activities, it's based on the plan, but it should over time then cover all the 4 objectives. So, and all the 4 of them, aim to achieve the overall goal, together with the policy measures and the policy dialogues we have. So I don't know what more in detail you expect. So it's really to watch out what is going on, not just in terms of goals, and then I think that's an important message, but also the political environment of that and the political discussions. I think that's then also we need to see that it doesn't stay at EU level and the EU with the member states representatives, but we're having also in mind that how we can make sure that we have kind of a national entity that will help us that integration at national level and have that more intense dialogue beyond the mission calls and the pure research topics.
And this, your answer leads to the next question. How does the Commission see the national mirror groups, how they could support achieving the goals of the cancer mission?
Yes, that's a very interesting development. We just recently, this morning, we had another meeting of what we call the subgroup on cancer, so with the member states delegates from the ministries. And we can see that even though the mission has been only officially launched 3 months ago, even less, that member states have reflected, oh, this is something we need to tap in, and we have to see how we can implement it at national level and absorb also all the, not just the money, but the recommendations, the dialogue. And that's what they've done, that we have, integrated that within the Commission. Member states now doing the same sometimes they call it even the mirror group, so that they have more the integration of health and research, have specific groups, some even including then the key stakeholders within a given country, and having, you know, this continuous discussions and accompanying the discussions at European level. And I think that's what will really make the difference. So I can really recommend for each country to do that, find the format it fits for the country, but really to have that similar structure group at national level.
Ms. Annika Nowak from Brussels, thank you very much for joining us at today's forum. And we move on from the European level now to the national levels, how the missions are coordinated in the Baltic States. And first, Estonia. Our case is presented by Ms. Kaire Innos, who is head of Department of Epidemiology and Biostatistics, National Institute for Health Development, and Dr. Vahur Valvere, who is Director of Research and Development, Clinic of Oncology and Hematology, North Estonia Medical Centre Foundation, Chairman of the Council of the Estonian Cancer Society. And here is the presentation, Estonian Cancer Control Plan for 2021 to 2030.
Thank you. Thank you for the introduction. So my name is Kaire Innos, and I work as a senior researcher in cancer epidemiology at the National Institute for Health Development in Tallinn, Estonia. And I have the opportunity and responsibility to coordinate the development of Estonian new cancer control plan. And the timing of our work largely with the development of cancer mission, but also the Europe's cancer plan. And these all documents have quite a lot in common, from overall goals to ways how to achieve the goals. And our new plan, we are quite proud of it. It's comprehensive and ambitious and covers all main aspects of cancer control. And I would like to take this opportunity here to share some of the essential elements of this plan. And my colleague, Dr. Vahur Valvere, will speak more about how the plan was put together. Our plan sets the vision for cancer control. This is like a long-term vision. And as you can see, it shares the goals with the cancer mission and the cancer control plan. So the vision is that fewer people develop cancer, people live longer and healthier lives after cancer diagnosis, and people living with cancer have a better quality of life. And so this is the long-term vision. And for the next 10 years, for 2021 to 2030, we have selected priorities to move towards this vision. And in order to reduce incidence, the priorities are the follows. First of all, lowering the risk of lifestyle-related cancers, mainly focusing on tobacco, alcohol, obesity, and also lack of physical activity. The second priority is vaccination against viruses that cause cancer. And the main focus here is on HPV vaccination, but also maintaining the vaccination levels for hepatitis B vaccination. And the third priority here is preventive screening to reduce incidence of cervical and colorectal cancer through detection of precancerous conditions before invasive cancer even develops. So the second vision, which is deals with improving survival for our cancer patients. The first priority here is to improve early cancer diagnosis for patients of all ages, and that includes actually children, because late diagnosis may be a problem for children as well. And this priority covers both early detection screening, mainly breast and colorectal, but maybe some other screening sites will emerge within the next 10 years, but also improving early detection for the cancers that are discovered through symptoms. So we are trying to improve awareness of the public of early symptoms, but also awareness of the primary care sector, and also reduce waiting times from cancer suspicion to treatment. The second priority here is to ensure optimal cancer care for all our patients. And this is mainly focused on centralization of diagnostics and treatment into cancer centers. And the third one is to ensure availability of care according to patient needs. And this covers both access to all sorts of palliative care, rehabilitation for all patients, but also in some cases, bringing treatment close to home. So people who need repeated systemic treatments, for instance, they can have them at their local hospital rather than traveling long distances to cancer centers. And the third vision, to improve the quality of life of people living with cancer, which means both patients and their families. So the first priority here is to design a patient-centered comprehensive cancer journey, which encompasses all different needs of the patients, including psychosocial support, but also rehabilitation, palliative care, and what the patient needs. The second priority here is optimal clinical follow-up of cancer survivors to detect relapses, new cancers early, but also deal with possible long-term side effects of cancer treatment. And the third point here is to pay attention to life beyond cancer and offer psychosocial support for people who have completed their cancer treatment and to help them to return to society, to their working lives, to their family lives. So these are the visions and the main priorities. Of course, our plan is almost 100 pages long, so there's a lot of other content there. But what I would like to show here is how we mean to evaluate the progress and results of our new cancer plan. And for this, we have defined some outcome indicators, which provide us the information on our long-term progress, but also we have a number of process indicators to measure progress in each different fields. So the outcome indicators are mainly age standardized cancer incidence, which we would like to see a decline in overall cancer incidence, but soon we would like to see a decline from cervical and colorectal cancer. We would like to see that our net survival rates achieve the level of Nordic countries, and also to reduce gender differences in survival, because men tend to have unfavorable survival rates compared to women. And also, of course, quality of life is one of the major indicators here. But we also have process indicators for different fields, and here I have listed just a few examples from different chapters of the cancer plan. And so we have defined targets and defined like deadlines for achieving these target levels for different indicators. The implementation of our National Cancer Control Plan, the key role here is with the steering committee and the Ministry of Social Affairs. The implementation plan, the detailed implementation plan, is still a work in progress. It's the responsibility of the Ministry of Social Affairs. There have been some delays due to the COVID crisis mainly, but also some staff changes. But even though we don't have the implementation plan in place yet, still we already this year in 2021, there are a number of activities that have been initiated by different stakeholders. And so I would like to highlight some of them here. And so all our cancer centers, cancer hospitals have started to design comprehensive cancer patient journeys to help the patients throughout their cancer pathways. Some hospitals have started measurements of patient-reported outcome measures and experience measures. We are moving towards gender-neutral HPV vaccination, so steps have been taken to include boys in our vaccination program. And we have also joined the EU Joint Action on HPV Vaccination Communication. We are developing a communication strategy for increasing early symptom awareness among the public. And as for screening, so in cervical cancer screening program, we have conducted a pilot study of HPV self-sampling to improve access for these women who have barriers for participating in the normal screening. And we have also done a feasibility study of lung cancer screening. And to move towards centralization of treatment, analyses have been initiated to support optimal organization of surgical oncology and radiation therapy services in Estonia. And last but not least, we are also preparing to transition to fully digital data collection for our cancer registry data, because the cancer registry is in the center of evaluation of the results of this cancer plan. And so to conclude my short presentation, I would like to highlight that our new cancer plan and the cancer mission have shared goals. And both documents put a lot of emphasis on research and innovation, but also equitable access and also patient-centered approach. And we sincerely hope that cooperating with other European countries and other Baltic countries as part of cancer mission will help us to accomplish our common goals in cancer control. So thank you for your attention.
And now we move to Mr. Vahur Valbreb, please. I hope Mr. Valbreb.
Thank you.
Okay,
thank you for introduction. Ladies and gentlemen, dear colleagues, I will briefly talk about Estonian cancer statistics, Estonian joining with World Cancer Declaration, Estonian Cancer Control Plan, and Estonian Cancer Patients Focus Group meeting in August 2020. First, Estonian cancer statistics. Cancer is a very serious problem in Estonia. Every year we diagnose around 9,000 new cancer cases, and every year we reached around 4,000 cancer deaths. 5-year survival of Estonian cancer patients has increased, and at the moment it's 63%, including skin cancer cases. Cancer prevalence, according to the Estonian Cancer Registry data, we have more than 62,000 cancer patients at the registry, with more than 68,000 cancer diagnoses. I will briefly talk also about a long journey to comprehensive cancer control plan. Previously, we had Estonian National Cancer Strategy for 2007 up to 2015. But if this strategy ended in 2015, we don't have at this moment a new plan for new control plan, and only some points, topics from this program were integrated to new population health development plans up to 2030. And that was the reason why Estonian Cancer Society started in 2019 a campaign against cancer with all of Estonia, and it ended with joining the World Cancer Declaration. It was signed on 13th of September 2019 by Estonian Prime Minister Mr. Jüri Ratas, by acting director of UICC Mr. Gary Adams, and representative of Estonian Cancer Society. Kaire already talked about main points of cancer control new plan up to 2030. I will also point out some essential parts. What's the main tasks of the cancer control plan? So main task of our plan is to map all the problems related to cancer control activities. It means cancer prevention, cancer diagnosis and treatment, rehabilitation of cancer patients, end-of-life care, cancer patients' pathways, learning, research and development in the field of oncology. And also one task is to set a precise action plan. The key issues are the financing of the action plan and the central monitoring of its implementation. And now a few words about the timeline of Estonian National Cancer Control Program preparation. We started the process on 19th of May 2020 when the steering committee was named. We organized 15 special working groups and representatives from Estonian 3 comprehensive cancer centers, general practitioners were represented, professional oncology societies, Estonian Cancer Society, Estonian Cancer Society, Estonian Society of Medical Oncology, University of Tartu, Tallinn Technical University, and of course, Ministry of Social Affairs, representatives of Estonian Health Insurance Foundation. And also we organized public engagement. It was on 21st of December 2020, and after the presentation it was open to the comments up to 10th of January this year. Steering committee approved our cancer plan at the beginning of April this year, and our Minister of Health and Labour, Mr. Tanel Kiik, signed cancer control plan on 13th of April this year. At the moment, we are working with the implementation plan. As I mentioned, we had 15 different working groups, and we had more than 100 persons involved. So first working group was primary prevention group, then early detection and screening, then cancer imaging and nuclear medicine, then special working group for organization of cancer care, how to organize, how many cancer centers should be, how it's coordinated, all anti-cancer actions. Then pathology and molecular diagnostics, including personal medicine, especially working group for surgical therapy, for systemic therapy, including chemotherapy, endocrine therapy, targeted therapy, immunotherapy, special working group for radiation therapy, for palliative care and end-of-life care. It's very important working group because it's not very well advanced in Estonia. Then a special working group for rehabilitation, for hematological malignancies, for living with and beyond cancer. Then a special group also for cancer data and research, then implementation, and for childhood cancers. What do we expect? What should be outcome from this cancer control plan? We hope that we achieve decrease in cancer mortality, decrease in age standardized morbidity at certain cancer sites, prolongation of life expectancy and increase in the number of patients recovering from cancer, improving the quality of life of cancer patients. Cancer patients' journeys have become smoother and more patient-friendly than they are at the moment. And also we hope reduction as minimum stabilization of the economic burden of cancer through optimized use of resources. A few words also about cancer patients focus group meeting, which took place in 19th of August 2020. The focus group discussed the project of cancer mission, and it was organized to discuss the main points of a new cancer mission plan, and also focus group discussed several new interesting proposals. Some proposals were really interesting and connected especially with cancer patients. For example, how to organize second opinion expertise from other countries, developed countries of European Union. The first proposal was, and then also to discuss possibilities how it's possible for Estonian and larger for Baltic States cancer patients to take part, for example, in clinical trials going on in other European countries. There are more clinical trials are going on than in Estonia, Latvia, and Lithuania. And that's briefly all. Thank you very much for attention, and I wish Merry coming Christmas to everybody. Thank you.
Thank you, Dr. Valvere, for Estonian presentation. But now let's turn to Lithuania, and here we have experts from Lithuanian Ministry of Health, led by Neringa Šeperienė, the head of Specialized Care Division of the Ministry of Health, and she will introduce the other speakers too.
Thank you very much for introduction, and I would like to present our team from Ministry of Health, my colleagues Eva and Yelena. We would like to provide some information about our country strategy in the field of oncology and relation with directions established in BT Cancer Plan. Please, next slide. Population of our country is less than 3 million, and cancer is the second most common cause of death in our country. And each year, nearly 18,000 new cases are diagnosed in our country. Next slide. National Cancer Control Program was established by order of Minister of Health in 2014. Action plans for each 3 years is being implemented. The program was designed to reduce the number of cancer cases and deaths and improve quality of life of cancer patients through the systematic implementation of a number of strategies for prevention, early detection, diagnosis, treatment, rehabilitation, and research. Please, next. The aim of the program is to reduce mortality rates from cancer, and priorities to improve cancer care coordination. Steering committee for monitoring the implementation of the program was established in 2014. And evaluation of cancer control is being made on an annual basis. Evaluation criteria of oncology care structure, process, and results are used. Every year, the report of annual results is published on the internet page of the Ministry of Health. Other actions and priorities to develop a healthy society, promotion of healthy lifestyles, dissemination of information on cancer risk factors, to improve of implementation of screening programs, to ensure timely, comprehensive quality cancer diagnosis and treatment, improve quality of life for patients with cancer, improve quality of training, to develop cooperation with non-governmental organizations, and to ensure a high quality cancer data registration. Next. Please, my colleagues.
So, good afternoon. If you can hear and see me. Actually, I'm Elena Talachkina from the Public Health Department of the Ministry of Health of Lithuania, and I will present you some initiative what we have in the field of alcohol and tobacco. And there is no doubt that alcohol and tobacco are one of the main cancer risk factors, which has a really significant contribution to cancer cause mortality and morbidity. Meanwhile, alcohol and tobacco are the most avoidable risk factors. And actually, currently we have a national drug, tobacco, alcohol control and prevention program, and it will be replaced in the next year by the Parliamentary National Strategy for Drugs, Tobacco and Alcohol Control Prevention and Harm Reduction Plan until 2035. And also the action plan will be prepared. It will be an institutional action plan. So the preparation of this new national strategy is being performed now, and we have really huge and comprehensive process, both involving other sectors and non-governmental organizations. And so we'll also expect to have an interinstitutional action plan in 2023. And next slide, please. And as regards to economical availability, it's really important initiative. I think it's really a success story what we have already adopted this year in summer, the law on excise duties, which introduced plan on increase in alcohol and tobacco excise duties. So for next 3 years, we will have constant annual increase for all type of alcoholic beverages. You can see how much, and also for all types of tobacco and tobacco-related products, and especially the heated tobacco products and electronic cigarettes will additionally excised, as in many countries, also I guess in Baltic countries, they became very popular. So, and the excise duties will for them will be reduced annually. Next slide, please. Yes, as regards to recent developments, what we have in Lithuania in tobacco field, we have expanded list of smoke-free places. Just recently, really by inspiration of our Latvian colleagues, we introduced ban on smoking on balconies, in private balconies, and also in outdoor cafes and public transport stops, children playgrounds, and outdoor events. We also have introduced the licensing of electronic cigarettes and also licensing of raw tobacco. And we also have introduced ban of advertising, promotion and sponsorship of devices to consume novel tobacco products and electronic cigarettes. And in the May next year, we will have also introduction of regulation of content of electronic cigarettes without nicotine. And in the future, we have plans to develop and strengthening smoking cessation services, and namely it's development of tobacco brief advice and smoking cessation services in primary health centers. It's a very important initiative in order to early detect risk and to help patients to quit And also we have the initiative on a national quit line. Next, please. What we have in alcohol field, we have really quite good achievements. And according to the WHO data, we have moved from the leaders from imposition of total alcohol consumption from 15 liters to 12.8 liters, and we are shifting to the fifth place from the test and to the fifth place. It's really an achievement for us. And we also have a really action plan to improve availability and quality of addiction treatment and reduce harm for next 4 years, adopted by the order of the minister. And we also introduced funding from the compulsory health insurance fund for Minnesota program. And it's really a small but very important achievement for us. And we're also developing alcohol brief intervention in primary health care. And we have really good achievement and in increase of services provided. Almost all Lithuanian municipalities providing such services, and the person who receive such services is increasing constantly. And some plans for the future in alcohol field, but we have almost 11 million euros regional fund for strengthening alcohol, tobacco and drug prevention in municipalities for the next 9 years. And we also have another dimension partnership project initiative to strengthening prevention work on municipality level in order to reduce harm caused by alcohol and drugs. It's really very good platform for exchanging good practice with our Nordic and Baltic colleagues. And also we will have for the future, probably next year, rehabilitation program within the framework of alcohol interlock system. So, and now I would like to pass the floor to my colleague Ieva. She's a nutritionist.
Good afternoon for everyone. So Europe's Beating Cancer Plan proposes harmonized mandatory front-of-pack nutrition labeling to empower consumers to make informed and healthy choice. So Ministry of Health has adopted keyhole labeling system in Lithuania. It has full compliance with Nordic keyhole criteria, and labeled foodstuffs is low in saturated fat, sugar, salt, and high in dietary fiber. Keyhole development task enrolled into national strategic documents and full list of keyhole labeled foodstuffs published on the internet for consumer awareness and for official food control. We think that keyhole is an easy, understandable logo for all elements of food chains, for consumers, for food producers. It is free and positive. Next slide, please. In the next 2 slides, you can see what the labeled foodstuffs or their places look like. Next slide. Here you see the labeled foodstuffs. Next slide. Now you can see growth rate of keyhole labeled foodstuffs in Lithuania, 2014-2021. And we are happy that in 2021, the amount of food labeled with keyhole increased almost 3 times. So we hope that it will be in future also. Next slide.
Thank you, Ieva and Yelena. What about cancer care? Primary healthcare institutions are responsible for preventive healthcare services, and since 1998 was launched the vaccination against hepatitis B, and vaccination against human papillomavirus of 11-year-old girls was started in 2016. In 2020, vaccination rate of target population was 62%. We have 4 cancer screening programs in Lithuania, and which are financed from the budget of the Health Insurance Fund. Participation rate in the screening programs are 47%. And the requirements for the implementation, quality assurance, and quality control of screening programs for cervical, breast, and colorectal cancers are being updated. To ensure timely, comprehensive, and high-quality integrated diagnosis and treatment services for cancer patients, there are 6 specialized healthcare hospitals which provide comprehensive cancer care. Appropriate healthcare facilities, human resources, and innovative technologies are concentrated here, and healthcare services are provided according to the descriptions and standardized procedures. To improve the quality of life and end of life for cancer patients, medical rehabilitation, long-term care, nursing services, palliative care services, pain treatment services, psychological services are provided. Next slide, please. You can see specialized cancer care centers. Specialized cancer care is given in 5 regions: Vilnius, Kaunas, Klaipėda, Šiauliai, and Panevėžys. Indicators of accessibility and quality of oncological healthcare services were established in 2017 by order of Minister of Health, such as multidisciplinary team is obligatory in order to create diagnosis and treatment strategy for each primary cancer patient. Is the limit on time period for diagnosis, limit on time period from diagnosis to treatment, etc. Next slide. The measures we took for cancer care in Lithuania from 2014 to 2021 are listed in the slide. We have established a National Cancer Control Program Steering Committee and indicators for annual cancer care evaluation, and also we created a website for sharing information. We established coordination centers of screening programs and continuing to prepare quality requirements for them. We launched a project for designing testing of the effective patient flow model entitled Green Corridor, and patient pathways for cancer of stomach, liver, lung, colon, and prostate have been prepared, and patient pathways for skin, breast, and pancreatic cancer are preparing. We have invested in development of infrastructure and innovative technologies, for example, in digital mammography system, linear accelerators, gamma knife, and other. All necessary means for collecting digital information are being implemented in our digital e-health system. We also financed a project to support non-governmental organization. Next slide. Our country supports the European Beating Cancer Plan, and we will contribute to the implementation of the activities set out in the European Cancer Plan according to opportunities and needs. And in order to implement the European Beating Cancer Plan, we will revise the National Cancer Control Program for mapping of gaps and knowledge opportunities. Measures which can be taken at national level will be continuing, taking in account our national needs and capabilities. We will prioritize the new cancer beating plans activities and decide on our opportunities of participation in joint actions. We plan to establish a steering committee to monitor the implementation of Beating Cancer Plan and to ensure close collaboration with stakeholders and to optimize our decisions. Thank you very much.
Thank you very much. From Vilnius, Inga Šeperienė, the head of Specialized Care Division of the Ministry of Health, and her team there. And now we go to Latvia, where is Professor Marcis Leja. He is European Cancer Board member, University of Latvia, Institute of Clinical and Preventive Medicine, and his presentation.
Good afternoon, and thanks for the possibility to present here. And I do not have the power to represent Ministry of Health, neither the cancer plan in Latvia, but as mentioned, the topic of my presentation would be how we anticipate recommendations of the Cancer Mission Board to be represented and how this could be implemented in our countries. And by starting, I would like to congratulate the organizers for this important meeting, because it's not so frequently that the Baltic countries are coming together and discussing those issues. And just to start, together with Andres Metsalu from Estonia, for more than 2 years, we have been involved in Cancer Mission Board. And just to illustrate how the activities there have been ongoing, the Mission Board met for the first time back in the September of 2019. Then it has been working with the draft recommendations and suggestions. During the summertime of last year, it was intense discussion with citizens, with stakeholders. Actually, Latvia was a country where also the general population was actively involved from the European Commission in just picking out the opinion, as well as thanks to patient organizations that have actively contributed. As a result of this, the Mission Board was presenting their recommendations to the Commission that got published in the final version in September of 2020. Thereafter, the implementation plan has been developed. There has been work either from the Cancer Mission Board part or the Commission part. And as already mentioned by Annika Nowak, in September of this year, finally, the implementation plan got published, and this is considered as official launch of the missions. And therefore, currently, already the tasks, the objectives of the current Cancer Mission Board have been completed. And now our obligations have come to end already. And I would encourage specialists from all the 3 Baltic countries to apply for the new Mission Board membership that is expected to be announced in the beginning of January. But let's go first back to the recommendations. And this is an implementation plan. And once more, what Annika has already mentioned, yesterday, the amendment to the mission program has been accepted, and it should be published, or maybe is already published today publicly. So please look into this and find the appropriate call really to go for. But back to the mission recommendations. And I would like really to go through them with a viewpoint of how really and who should be implementing them. And what will be the conclusions of my presentation by the end of this presentation is that it is not really only Ministry of Health. There are a number of ministries that have to be involved. There are a number of stakeholders, patient organizations, civil society groups that have to be involved to implement the recommendations successfully. And whether we will be able to reach this goal, let's see how we'll be going on. First of all, in respect to the recommendations, as you can see here, they are marked in different colors, meaning understanding, prevention, diagnostic and treatment, quality of life, equitable access, and cross-cutting actions. First of all, in respect to understanding, and there we do have two recommendations. One is UNCAN, that is the acronym for Understanding Cancer, meaning a Europe-wide platform for research organizations to really identify the missing needs and the missing knowledge in cancer research. Those calls have been out already. Those were the first calls to be out in the initial calls. And currently in the updated program, updated version, there's also activities related to this. Development of EU-wide research program to identify polygenetic or genetic risk scores is another important part that is planned to be announced during the upcoming period. The next two recommendations relate to prevention. First of all, the support to development and implementation of effective cancer prevention strategies and policies. And actually, this is not so much related to the obligations or to the functions of the Ministry of Health than even Ministry of Finance, because it's including the tax policies. And what we heard from our Lithuanian colleagues is directly related to this taxation of alcohol, of cigarettes, but ideally this should be harmonized at least on the regional, meaning Baltic, or ideally European level. Optimizing of screening programs is definitely requiring additional attention, and what is stated and what is emphasized in EU Beating Cancer Plan is really the high quality of those programs and compliance to the EU recommendations for quality assurance. The next two actions related to diagnostics and treatment, it is personalized medicine approach, early detection and minimally invasive treatment. Those are both related to the functions of the Ministry of Health, but also to Ministry of Education and Science, because it's really scientific and research programs. And in general, the EU mission activities go under the DG research part of the program. The following recommendations in diagnostics and treatment is to develop the research program and policy support the quality of life of cancer patients, survivors, family members, and cures. And we heard it very well how it's depicted in the Estonian program. So I think there is still a way to go to achieve really the targets. And what Annika Nowak has been mentioning is the European Cancer Patient Digital Center, very important part with exchange of information. And actually earlier today, that was a subgroup meeting on cancer hosted by the European Commission, where this has been debated quite a lot and many questions have been arising, and our countries were also present there. The next two under the equitable access is cancer health equity and comprehensive cancer infrastructures. And once more, this, in addition to the Ministry of Health activities, is requiring other the Ministry of Welfare or other structures to be involved, including also the structures that are responsible for digital transformation. Last but least, the cross-cutting actions, including childhood cancers, including acceleration of innovation, and there is the place where the Ministry of Economy should be coming in, and finally transforming of culture, communication, and capacity building into this. Now, what we can see and what is the way actually where we are currently in Latvia, and we are happy to tell you that we have been searching and been successful for applying for the technical support instrument That is a funding that is going to international experts to be evaluating and providing the recommendations on improvements to be made. And such a project has been finally supported for Latvia and Slovakia currently by DG Reform. And those are the key activities that are under this project supported. It is, first of all, improved cancer registration, evaluation, and recommendations for improved registration. Further on, that is improved cancer screening, the same analysis and recommendations for screening. And finally, evaluation of the path, the guide, how to really get to comprehensive cancer center, international accreditation and networking in Europe, what is also among those recommendations. And I have to mention that either Lithuania or Estonia have accredited a cancer center. Congratulations with this. We do not have a cancer center accredited in Latvia. Nevertheless, the EU recommendations is until 2025 to have an accredited comprehensive cancer center in each of the EU countries. And honestly speaking, this is an unrealistic target for this period, because it would be ideal if, for instance, in Latvia, we could get to the cancer center accreditation, but it is absolutely unrealistic within a couple of years to have a comprehensive cancer center accreditation. And there are certain criteria I'm not going into currently. What are the other activities in Latvia? There's National Cancer Plan, although for a shorter period of a time that is in the final approval stage, mainly because of the budget issues. I mentioned already that the country has taken the decision, and that is the Riga East University Hospital, Latvian Colleges Center is in its structure, has started the process to achieve the accreditation for OECI, but once more, only for those double CC, not for the CCC, that is a target. We do have two laws under development, the biobanking law and more recently the law on secondary data use. And finally, maybe that is a relatively smaller project, but once approved, that will be the first from in any of the Baltic states, a project on gastric cancer and precancerous lesion prevention and data infrastructure behind this has been submitted for GAIX platform. That is a European open data platform that is really we see as a future for Europe with large data. Finally, how really, at least how I and many other of the mission boards members would see the future of the missions on a national basis, and those have been the recommendations from the Commission to have national cancer mission hubs. However, it is no definition on how those hubs should be looking like, and those countries already having this still do have a bit different approaches to these hubs. At least how I see that all the relevant ministries, and I have put the names of the ministries, at least according to what we do have in Latvia with the relevant responsibilities, should come together. And really this mission approach could be attributable on a national level, but only the ministries cannot decide this. There should be hospitals, there should be universities and research organizations if they are outside the university administrative structure, and definitely patient and citizen organizations, as well as industry and other stakeholders. So in the case, if we would be successful to develop on a national level this, we would be much more effective in really trying to have the access to the European and national funds as well for the common objectives. Thank you.
Thank you, Professor Leja from Latvia. And next, concrete case studies on the cases regarding cancer and fighting cancer. First, Lithuania. Professor Sonata Jarmalaite is from Lithuania's National Cancer Institute, and she will speak about the National Oncology Network for Improved Cancer Control.
Thank you. Good afternoon, everyone. So it's a pleasure to speak in this collaborative networking teaming project. And well, our ministry nicely presented already our cancer control means. So let me shortly introduce our collaborative projects, which are ongoing and making our country a little bit closer to European Union cancer beating plan and cancer mission. So as already it was introduced in Lithuania, we have 6 specialized oncology service providers, major university clinics, National Cancer Institute, and 3 other clinics. Next slide, please. So for this presentation, I selected to show 6 collaborative projects, which includes collaboration between specialized oncology clinics and universities, institutes, and so on. So next slide, please. So for improved clinical care, we of course need an innovative infrastructure. And our country, since 2019, is building a project of national biobank system. So this project includes nice collaboration between oncology clinics and universities, and with a plan to build 5 facilities specialized for biobanking, and to obtain hundreds of freezers and thousands of biosamples in order to build national biobanking catalog and support cancer research. And of course, a very important mean is to join European structure, biobanking and biomolecular resources and research infrastructure, which our country is already a presenter. Next slide, please. Innovative infrastructure and genomic analysis actually is coming closer and closer into the clinics, and with the aim actively participate in another innovative infrastructure of Europe Union, which is called 1 Million Genome Initiative, which already connects 25 countries from Europe Union. Our country created a national mirror group, which started to organize a genomic network in our country. And we already succeeded to prepare national genomics plan and apply to the recovery and resilience facility for the funding, and have a task in the nearest future to sequence 1,500 our Lithuanian genomes. But of course, the main task is to make these innovative techniques closer to the patient, closer to the clinics. So next slide, please. All these infrastructures, biobanking and genome analysis, of course, they are very important tools for cancer research, but we also aim to develop projects which are closer to patient-oriented tools. So our national team from main specialized oncology clinics united our efforts in order to build a national personalized oncology initiative, and prepared tumor-agnostic genomic analysis-based treatment protocol, which is close to European protocol, the drug discovery protocol. And with a collaboration with our Ministry of Health and our local health assurance fund and our commercial partners, we are building an infrastructure, our National Molecular Tumor Board, in order to make personalized treatment closer to the patient and to have innovative solutions for the clinics. Next slide, please. And even more advanced project is thinking about not only personalized cancer treatment, but about personalized cancer prevention and early detection. With the same here in National Cancer Institute of Lithuania, we started a collaborative project with commercial partner Thermo Pharma, where we are using liquid biopsy technique in order to create an innovative test for early detection of prostate cancer, kidney cancer, and maybe in the future for other localization, which will allow us early and by using non-invasive means to detect cancer and to start treatment as early as possible. Next slide, please. And of course, organization of clinical resources, timely and precise diagnostics is very important for successful cancer treatment. So to shorten the diagnostic pathway of each patient who is facing the diagnosis of cancer, all 6 our oncology clinics started a collaborative project in order to optimize the flow of oncology patients. And the main idea of this project is to prepare a new specialist which can assist oncologists. So it's cancer patient care managers who will in the future will assist clinicians and patients to make the diagnostic pathway shorter and to make the treatment as early as possible. So this project is ongoing with the help of our Ministry of Health. Next slide, please. And of course, this period is marked by not only this cancer beating plan and our cancer mission, but also this pandemic period. And this period impacted cancer service actually very, very strong. So National Cancer Institute, in collaboration with other clinics and university, overtook the effort to contact all primary care, all possible primary care units and clinics who is providing cancer service and who was providing the service during pandemic. And we contacted them with questionnaire in order to learn lessons from this complicated period, and with the aim to make oncology service more sustainable, resistant to such pandemic periods, and to prepare recommendations for future service providing in such complicated situations. So this is a short period project which is ongoing with the support of Research Council of Lithuania. Next slide, please. And National Cancer Institute and other clinics, they are doing a lot in order to disseminate the information about the cancer mission. And we had several events for citizens engagement actually, and they were providing the solutions how to improve this cancer mission and cancer beating plan. And during our National Cancer Institute anniversary meetings, we had a lot of events and lectures where the cancer mission was presented. So thank you for your attention.
Thank you, Dr. Jarmolaite. And next we go to Latvia. Tom Storims is CERN Baltic Group Chairman, and he will speak on advanced particle therapy for cancer treatment in the Baltic States. Please, Mr. Storims.
Yes, good afternoon. I hope you can see a presentation, and I understand that we're a bit short of time, so I'll be very brief here, hoping for questions afterwards. So there is a CERN Baltic group. CERN is one of the biggest scientific labs in Europe. And of course, it's all about high energy physics and engineering. However, there is very clear application of this technology towards cancer treatment. And that's what I'm going to tell you today. So CERN Baltic Group is up and running for 3-4 years now. There are 9 members. However, if we consider this advanced particle therapy center in Baltics, the idea which we are promoting, Lithuanian University of Health Sciences and Tartu University Hospital also are expressed willingness to join into this flagship project. We really believe that that we are ready to stand on the side of those who need us, as the president of European Commission said when she was announcing this initiative. So this is very shortly about CERN Baltic Group. CERN in Geneva, this is where I'm sitting now, 27-kilometer underground tunnel. So we are discovering beauties of universe and fundamental physics. However, there are a lot of spin-offs and a lot of technological applications towards society, and one of them is this next ion medical machine study. Basically, CERN is providing its scientific knowledge and to the development of cancer treatment technologies and devices for in application of advanced technologies onto the ground. And of course, the idea as such, and most of the scientists here will know, it's not new per se. However, if we compare heavy ion therapy with other technologies which we are having now, for example, with X-ray, there is indeed a big potential in very physics of this phenomenon that we can basically burn out cancer much more efficiently without damaging healthy tissues in a patient. Of course, it is not panacea, it's not applicable to everybody, and of course it's most useful in pediatric cancers and in skull treatment, etc. This technology is evolving. There are new opportunities with flash therapy. Medical physicists will know what I'm talking here about. However, so all theory is very nice where we are in a practice. And in practice, if we compare, we look at our DNA of cancer cell, we see that with X-ray, we heavily damage it. With a proton beam, we damage it even more. But with carbon ion beams, this new technology, we really can destroy this. So there are no relapses, and the theory shows us that it could be really much needed therapy for a future. And of course, so far it's very expensive, and technology is just at the beginning of its development. There are 4 centers in Europe and in other places. So Japan is one of the leaders, and there are different technologies being currently applied. But one of emerging technologies now, it is this helium ion application to this cancer treatment, and this is where we are as a CERN Baltic Group working together with the CERN and willing to proliferate. If we look at this wonderful map where you have a nice belt between Finland and Balkans, we see that there are a lot of treatment centers in Europe, and they do it for some reason. And nothing in our region. And there, of course, are reasons, because, as I said, it's not panacea. You cannot apply it to every tumor everywhere. So this is kind of bit of niche product so far. But if we put Baltics together, I think there is a critical mass for that. And this was recognized as well by CERN and other stakeholders. So this is technical concept of this helium single cyclotron, which we could develop with the help of CERN and with other partners. And this is really where we want to go and to push technology forward and engage communities of our Baltic partners. So we believe that we really can change this wonderful map into the way that we are back in game. Not only I'm speaking here about cancer treatment, I'm speaking here about high energy physics, I'm speaking here about medical physics, about diagnostics, about treatment, about merging engineering with the medical science. So this could be a real flagship project, real game changer. So we very much believe in that, and most of stakeholders in our countries to whom we consulted about this were kind of supportive towards that. So we would like to continue with this. Thank you.
Thank you, Mr. Torim. And next, since the time is short, we turn to the next panel and the next topic, NGOs and their role in the European Mission Cancer. And the first to speak in this section is Mr. David Ritchie from Association of European Cancer League. Please, Mr. Ritchie.
Hello, hi. Can you hear me okay?
Yes, we can hear you.
Okay, just give me 1 second and I will share my screen. I'll try to make sure it's the right view. And let's hope it works fine. Of course, I'm not going to start at the end, although that would claim back the time. 1 second, sorry. So whilst it's just taking a few seconds to load, thank you everyone to the organizers for the invitation. It's really a privilege and pleasure to be able to present here today this very interesting meeting. Just to confirm, you can see the full screen of the slides. It's okay. That's great. So thanks everyone again for the invitation and for thinking of us at ECL for this particular slot in the program today to talk about the possible contribution and roles that non-governmental organizations, civil society organizations can have within the cancer mission and other research actions supported by the European Union. Just to give a few words of declarations of interest, kind of housekeeping from our side, to be transparent, because of course it's important as a non-governmental organization that we are transparent about our sources of income and funding. And you can see here on the screen our main sources of income primarily through our member societies, but we do also have grants with the European Commission and one private sector partner, which is L'Oréal Garnier, which is unrestricted grants for educational purposes, capacity building with the members. So they have no input to the content of the work itself. A few words about ECL, just for those of you who may not be aware of us. We're an NGO ourselves, but we're in the form of a network. So we have member societies, or to use our nomenclature, the leagues, the cancer leagues, and there are 30 members currently in our geography, which is broader than the European Union, which is Europe according to the UN definitions, following UN, WHO Europe region. And we have the 30 members within there, so ranging from the furthest north to Iceland, with Icelandic Cancer Society, through to further south to Turkish and Israeli cancer associations. And we've existed now since 1980. And you can see there's a small gap, unfortunately, in the Baltic regions, which we'd love to fill, and we should prioritize further in the coming months and years. A few words about our actions, projects, and initiatives. And a couple of these I will zoom in and focus on in the time available for the presentation today. You can see on this chart some of the areas and actions that we have and that have the semicircle. These are, in some cases, Horizon 2020 projects, other cases, the joint actions of the under the EU Health Programme and soon to be EU for Health Programme, and other initiatives in which we're involved with the curating, such as the triennial conference on the European Conference on Tobacco or Health. And these are sort of linked to our standing activities as you move into the center of this semicircle, which are our standing working groups in prevention and early detection, in access to medicines, so looking at equity on the issue of and affordability of medicines and drugs in particular, and patient support working groups, so looking very much at the connection with patients and their families and trying to improve services there. And all of our actions that we do in terms of projects, initiatives that are European-wide in scope, research projects, implementation research, etc., all feed into and connect with the working groups themselves, which are composed of the experts from our member societies who are working in those particular domains. So these two here, if you can see on the screen, my PEPS and Civic Screen project, I will talk a little bit later to give two particular examples of the possible roles that NGOs can play within cancer mission supported research project. Those two projects are from Horizon 2020, and I will talk to you a little bit about how we engage and work within those particular projects themselves. Just as an example, and to inspire also those listening in the non-governmental and society sector, that it is possible to be a very active and important player within such projects and initiatives. Turning to the title that we were given for this particular intervention on the role of NGOs, I think I can sum up the roles of NGOs according to the three areas that I mentioned on the screen. The first being addressing gaps. So this is really using non-governmental organizations to build and add capacity, filling in vital services which are under-addressed by the system. And this is a particularly important area when it comes to vulnerable and marginalized groups. NGOs often play the only role in providing services to such groups. And so this is an important element that the non-governmental organizations, civil society actors can bring into a research project and really speak for those who have a limited voice and representation elsewhere. Secondly, we also can bring in resources through fundraising ability, but also on a human level with the substantial army of volunteers that NGOs can marshal. And this also provides an important route for sustainability. So you hear a lot in the jargon and the discussion and European circles around projects, but also with policy dimension and there's such things as the Beacon Cancer Plan. You hear a lot about sustainability of the actions of projects, what happens basically at the end of the lifespan of a project. And NGOs can be a useful route and bridge to secure and sustain actions beyond the limited lifespan of the funding under mission-supported research call, for example. So they're important for that perspective, and I think add strength to any proposal and consortium by offering that route to longer-term sustainability. And then most importantly, NGOs provide proximity to citizens, or more specifically, perhaps in healthcare setting, to patients. Being close to the citizen provides a critical feedback loop into the research projects, but also for the outcomes that they seek to achieve. So when you look at some of the recommendations that came up from this first iteration of the cancer mission, the 13 mission recommendations from the mission boards, and you can really see that patients are the center of all of these. They have an important contribution to make to all elements, and as was mentioned by Professor Marcis previously, there was a widespread discussion and engagement with NGOs and with citizens in the build-up of the work plan for the mission itself. So this is really the critical areas, I would say, that where civil society can be of greatest value and play a real important role within research projects and the cancer mission implementation, etc. So to the two examples, the first is a Horizon 2020 project, my personal breast screening. I won't go into too much detail on the project. So you can see I put some of the information here for when the slides are shared afterwards, so you can read a little bit more and also visit the link to the website, which is very comprehensive. But in a nutshell, this project has at its heart a randomized control trial, which seeks to compare standard practice for mammography screening with a new risk-based or risk-adjusted approach, which takes into account factors other than simply age, which is the case more or less now for standard organized screening for breast cancer at the moment. And at the end of the project, we want to see if there's at least as good, at least as strong outcomes for improving mortality around breast cancer from the implementation of the new risk-based approach in comparison with the standard practice. So you can see on the left-hand part of the screen some of the main endpoints that we're looking at. Engagement of stakeholders is really important for us, and again, this will be an area in which the NGOs can play a significant, important role through being that bridge both to end users but also to decision makers. Very briefly, I will, just for the sake of time, won't go into too much detail on how the project itself is structured, but would rather highlight where we as a non-governmental organization fit within a complex randomized control trial that spans 6 countries and tries to recruit 85,000 women into the trial itself. Our role is particularly on 2 areas, but we would say the most important or most substantial commitments we have are in the area of communication and dissemination, to prepare again for communicating to wide stakeholders, but also to decision makers and to the public at large, and not least also to the target group, which are women of the age for breast screening. Here I mentioned there are 6 countries in which the trial takes place, but there's also other countries in which are involved within this large consortium, and highlighted in yellow are some of the non-governmental organizations that take part in this project. The second project I'd like to highlight also from Horizon 2020, and this project is called the CBIC Screen. So this is basically a program which seeks over a period of 5 years to broaden the coverage of cervical cancer screening by exploring different measures through a co-creational approach to improve the screening offer to women in vulnerable and marginalized settings. So we're thinking about groups such as incarcerated people, women, those living with HIV, sex workers, etc. And here, because you have the co-creational approach, the NGOs are crucial for facilitating and engaging with the target group, with these particular groups of women and also their representatives and advocates, to discuss how to improve the offer of cervical screening in order to give them more of an ability to take part in such screening program. So at the outcome of this, we will do a pilot in 3 countries to look at different methods and strategies to reach these particular groups, after having an extensive multi-level process of integration and engagement with the target groups themselves to come up with a more robust and suitable system to provide the screening to these particular groups. And this will lead to some policy recommendations to provide to decision makers afterwards. I'm happy to say that within this project, we have Estonia as one of the countries for the pilot, and so very active within the other elements of the scientific component of the project itself. So those were 2 particular examples of how we conceptualize our role and implement it in practice as an NGO to be involved within research programs. I think this applies also more widely to many of the elements that the Cancer Mission tries to support and endorse. So thank you again for the invitation. I'm happy to any questions.
Thank you, Mr. Ricci. And now we are short on time, as usual, during these conferences. For the next 50 minutes or so, we'll be joined with 3 NGOs, 4 NGOs to be precise. And let's go first to Kaili Sem, Chairman of the Board of Estonian Association of Parents of Children with Cancer, and her short presentation.
Thank you very much. Thank you for the possibility to share our experience. As we have a lack of time, I try to be very brief. And first of all, I give a very brief overview of our association and our activities, our main mission. Our main mission is that every child in Estonia with cancer and their parents must receive necessary treatment not depending whether the treatment is reimbursed by the healthcare system or not. And in case the medicine or the treatment is not refundable by the national healthcare system, our association finds donations, initiate campaigns, cooperates with other NCOs to guarantee the treatment for a child and to support their parents. And of course, in addition to medicines and treatments, we reimburse and provide support, any kind of support what the families and children with cancer need. Of course, when we re-established our association in 2013, we saw that there are lots of problems which need to be solved related to children with cancer and with their parents. But actually, we had no money at all, and this is what I understand that my role here in this conference is to convince you that the mission impossible is actually possible. And when you have a very good will, you can change the world. And if you have lots of voluntary, lots of energy and voluntary power, you can actually do lots of good things. And so in 2013, we understood that there is a need to collect donations and to provide services to children with cancer and their parents. So we thought that we don't want to initiate campaigns and to ask for more tears or sorrow from donators, because our stories and our cases are quite hard and difficult to bear, and that's why we decided that we have to initiate some kind of fun event and provide joy and provide lots of good emotions when people or persons donate to our association. And so we initiated the duck race, which is basically a charity event. It's initiated by our association. And this is actually a rubber duck rally, which takes place in Tallinn once a year. Usually it's in the beginning of summer, except last year due to COVID crisis. And basically the duck race could be described as rubber duck rally in Kadrioru Canal. And the main issue or main how to say, basically the campaign involves providing lots of information to the possible donators. And finally, every person can donate money via our webpage, starting from 5 euros per rubber duck. And person will receive a duck number in return. So every duck which is released to the Kadrioru channel has its own number. And of course, as I said, it's a race, it's a rally. So the first 3 ducks, rubber ducks, which are released to the channel will get the award from our sponsor. And of course, also the laziest duck receives the award. And since 2014, we have initiated this campaign in 2014. And since then, the number of ducks which we release to the Kadrioru canal every year, it has been increased enormously. We started with 7,500 ducks. So the last year, the number was 15,000 ducks, rubber ducks in a channel. And this is the start of the duck race, a duck rally. And there are lots of competition. It's a very, very, how to say, tight rally. And we have collected enormous, for us, it's an enormous amount of money every year. Last year, the donations were about approximately 400,000 euros. And this year, the rally took place in 1st of June, and we collected 3,500,000 euros. So basically, this is the very brief overview how you can make things possible when they seem to be very impossible, and when you have a very good will and lots of energy, so you can make huge things and change the world. So thank you for your attention.
Thank you, Kaili, for this presentation. And we move on to Lithuania from Estonia here. And from Lithuania, we have Neringa Šeperienė, Director of National Lithuanian Cancer Patient Coalition, POLA, who will brief us on activities for the cancer prevention there. And also Professor Tomas Lapinskas, Director for Public Health Research and Education at the Hospital of Lithuanian University of Health Sciences, Kauno Klinikos, and he's also a member of the Hospital Board of Executive Directors. So Lithuania next.
Hello, everyone. So it's really a pleasure to participate here. And today I would like to give some examples of how POLA participate in different prevention activities, related to cancer screening, early detection, and promotion of healthy lifestyle. I'm trying, okay. So what is our mission? Our mission is to improve quality of life of all cancer patients and give them, to restore them the joy of living. And POLA is one of the largest umbrella NGOs in Lithuania and one of the biggest organizations of patients. We unite 30 NGOs and more than 26,000 of cancer patients. All of them are members of our organization. We have a POLA card which represents their membership, and our organization is quite young. Soon we will celebrate our 10th anniversary, and really we are proud that we have some memorable results and really have what to present some very good examples. At the very beginning, I would like to emphasize that we as an NGOs, we are quite active in patients advocacy. And really, we see a problem that in Lithuania, we have a situation when which needs to be improved. Our national cancer program is not updated since 2014. We have one of the lowest in the EU share of funds allocated for cancer treatment per capita. We have one of the worst 5-year survival rates in the EU for lung, liver, breast, ovarian, cervical, and other cancers. We have about 18,000 new cancer cases per year and about 8,000 deaths per year. And since we have 4 screening programs, but participation rate is quite low and reaches just about from 40 to 50%. And every one of us know that in order cancer screening programs to be effective, the participation rate should be about 80%. So what we do in order that the situation would get better, we really invest on education, on cancer prevention and early diagnosis. We produce different booklets and leaflets about the lifestyle, about early detection, what are the important symptoms our bodies sent to us, and what symptoms need to be recognized and then later reported to our doctors. Also, we organize numbers of seminars and webinars for our patients and for general public. We initiate different articles in the media about the prevention. Also, regularly we do posts in social media. We have a YouTube channel where we have several tens, about 20, 30, 50 different videos related to cancer prevention and living with cancer. From time to time, we initiate some public awareness initiatives, and we go to the streets, we talk about the cancer, we organize such support actions as marathon runners, as some physical activities. We invite well-known public faces talk about cancer. And here you see the picture of our former president, Mr. Adamkus, who is also cancer survivor and who called to go for the cancer screening. You know, that means he was saying that checking means living, so you need to find some time and to go for cancer checking in order to address and to invest to your future. Also, we have some joint efforts empowering patients to prevent cancer recurrence. We know well that it's one of the main threats of cancer patients, that the cancer, after the active treatment, the cancer will return. So we have a big cancer patients communities on a social network in Facebook. We have about 3,000 patients and caregivers in these groups, addressing their questions, talking about symptom management, pain management, and other issues. Also, I would like to present some exceptional example of cooperation which we had several years ago. On February 4th, 2017, we presented a social initiative which was called Skylame į kovą su vėžiu, which means United to Fight Cancer, and which initiative was marked by signing some cooperation agreement in our parliament, and which cooperation agreement was signed by the politicians, Ministry of Health, also business representative, media representative, and also NGOs. And this initiative called target age groups to pay some attention on importance of timely health screening and to go to register for the cervical, breast, prostate, or colon cancer prevention programs. And this initiative lasted for 1 year. And during this year, about 2 million SMSs were sent free of charge to every person which was included in these age groups. And also JCD outdoor advertising boards were spread across Lithuania with a message that one of the 3 can avoid cancer. We have published dozens of articles in web portals. One of the main portals was Delphi, and all topics were related to cancer prevention, early diagnosis, and cancer screening programs. Also, we had social video advertising as video on TV, and the message in this TV was, check your health for your loved ones. This program didn't require any funding. Everyone participated free of charge and really was marked by as a very good example of cooperation between the public, state, and business institutions. But still, we see that in Lithuania, cancer screening programs for years lack efficiency. Due to the COVID situation, thousands of cases are still undiagnosed. Public authorities do not pay sufficient attention and resources to cancer prevention, and all the activities of NGOs are based on their own initiative and resources. Mechanism of cancer prevention programs is currently underway, but patients' organizations are not involved. And we see that EU cancer plan doesn't find its place between the government's priorities, and national cancer program is not updated since its elaboration. And really, we hope that this conference will bring the change, and soon all stakeholders will be invited to develop an updated national cancer program, which we see already happened in Estonia and in Latvia. So thank you for the example. We will study your papers, and we really hope that in Lithuania soon we'll have an updated version of the national cancer plan and program. Thank you for the attention.
Thank you. And next we go to Professor Tomas Lapinskas.
So very good afternoon, everyone. Indeed, I can see my slides. So actually, I would start when we speak about the high-performing hospitals and high-performing healthcare systems. So probably we also need to have in mind quality improvement. And one way how we can achieve it is through the patient engagement. Can I have the next slide, please? And of course, health outcomes are recognized as those events occurring as a result of an intervention and may be measured clinically, maybe self-reported or observed. And patients who are engaged and can contribute to their care plans tend to have better health outcomes. And the ways in which patient engagement contributes to improvement healthcare outcomes for both patients and care providers, so we might have in mind the hospitals, include patient satisfaction and patient involvement. Next slide, please. And the patient experience during the treatment and care can be more critical to the individual than now, and how clinically effective the care has been. And actually every visitor, or we can say patient, expects every staff member to be motivated and enabled to deliver effective, safe, and person-centered care. So therefore, the engagement of patients, carriers, patient and carrier organizations, as we have in our institution, also staff members, local authorities, and the broader community in defining the quality strategy, also, let's say, monitoring outcomes and developing quality plans could significantly impact quality of improvements. And next slide. So therefore, we decided to make those two things, just engage our patients through patient satisfaction and through the creation or establishment of patient counselor. We are very proud because they're helping us to improve a lot. And our main goals are to ensure the full involvement of representatives of patients, also staff from the other things, and also the broader community in developing and refreshing our quality strategy. Also, patients, when they are involved, they can help us to redesign the process and services. Also, we ensuring that patients and carers know how to give a feedback, which is appropriately performed. And we also regularly perform and receive reports on how this feedback has been used to improve services. So as you can see in the slide on the right, we always have the proposals from the patient council with the regular meetings when we discuss what can be achieved, how quickly, and we also make a priority list. So we are happy of these proposals. And on the other side, we also monitoring the temperature, what we like to say about the patient satisfaction. And we have these QR codes when the patients can scan and fill the questionnaire, and when we can get a report, where is a problem, in what department, and how we could solve the problem. So the next slide. So I will say the very thank you very much for the time, and that's our experience.
Thank you very much. And now we're going to our final speaker, and it's time to introduce an actual startup from this field. And this presentation will be by Dr. Neringa Šeperienė from Lithuania, who is a co-founder and CEO of medtech company Albamentric Holding, deep tech startup called BranchyDOSE. The startup has successfully developing partnership with French and also Estonian institutions here. And the floor is yours, Dr. Neringa Šeperienė.
Hi, everyone. I hope you can hear me.
Yes,
so my name is Neringa, and I'm co-founder of the engineering medical device engineering company Albamentric, and we hold the startup called BranchyDOSE. And BranchyDOSE startup is specially dedicated for cancer treatment quality control in radiotherapy procedures. And while most of the startups in a medical devices or medical field is seen as pharma startups or some wearable instruments, there's like more than 3,000 startups which is doing the radiotherapy, pharma, other oncology focused solutions for cancer patients treatment, diagnostics, surveillance, helping the patient. And the good thing is that we have now in European Union a bit more than 14 unicorns at the moment. So they have a valuation more than €1 billion. And all the investment in these medical startups dedicated for cancer treatment is increasing every year. And the last year it was a bit more than $92 billion. So the next one, next slide. Thanks. So actually, the startup is a small business at the beginning, and it won't go to the market without the help of the bigger companies. And as a small enterprises and startups, we see that in the first half of this year, the most of the oncology orientated startups went to the market with the help of Roche, Merck, Johnson & Johnson companies, Novartis, and similar. And much more are coming for next year. So next slide. So about our BranchyDOSE startup. So we started to develop it about 3 years ago. While we are medical device engineers, data specialists, and I am a medical physicist myself. So next slide. And why is the radiotherapy so important for us? So we've been working in national projects in hospitals, and with the project which was dedicated to reduce the errors, reduce the radiation for cancer patients. And we've seen the big problem in the radiotherapy procedures, especially for brachytherapy, that there is still the uncertainty in dose of the radiation. And these uncertainties makes a big difference in the final treatment outcome. We use radiation to kill the cancerous cells in these radiotherapy procedures, and it also could damage the healthy organs. So it ends up into painful wounds for cancer patient, finally, it adds additional costs for hospitals' radiotherapy departments, and it also takes additional time from a doctor to retrieve the patient and to decide what to do next. So next slide. So we made the hardware solution which measures the specific radiation dose which was applied to a patient and collects the data and integrates all the collected data and shows it to doctor, and he or she can take this set of the data and to support their decision on the next treatment and prevent up to 80% of common cancer treatment cases in a radiotherapy, like for prostate, cervical, breast cancer cases and brachytherapy procedures. So next slide. So first we orientated on a patient first. We wanted to help patient to leave the hospital faster and then to save the costs for radiotherapy departments and save the time for a doctor to prepare and execute all the procedure. Now, next slide. In our solution, we prepare it to be 100% personalized. So it's orientated in a personalized medicine or personalized device. And it's easy to implement, so that's how it's different from other already in the market solutions. So next. So it's going to be the single-use dose measurement tool, and we are going to provide it to hospitals, cancer treatment centers, together with those measurement, whole dose measurement system, which will help to decide what to do on the next treatment steps. So next. And now we have a prototype which is undergoing testings with the help with the National Cancer Institute here in Lithuania and all the international partners. And we started this project, whole development from Horizon 2020, a project, and also we're funded by EIT Health Fund and Lithuanian Science Innovation and Technology Agency. So the next. And these, as other organizations, we face also big challenges. So one of them is financing. So these cancer missions is also a huge thing for startups and SMEs to show themselves, to get into the network and to attract more finance from venture capitals and other investors to proceed on our devices. So while this radiotherapy is done in more than 150 countries, we are planning to reach with our device more than 7,000 of the hospitals and cancer treatment centers in European Union, United States, and more than 1,000 of them we can reach in European Union. So next slide. So this is our team. We are medical device engineers, data specialists, and we work together for more than 10 years in various engineering projects. And we are happy to be backed and advised by international team, which is on the other slide. Yeah, so we partner with clinical partners from Lithuania, National Cancer Institute, also Estonian Health Medical Centre, Heidelberg University Hospital, Sorbonne University Hospital, also business development partners from France, Medicine Paris region, United Kingdom, and the next one. Yeah, and before all these pandemics, we applied for accelerator to accelerate all this business and to go to clinical trials. And BranchyDOSE was a winner of EIT Health InnoStars Award and was recognized as one of the best healthcare solutions. What it was all before the pandemic situations. So we participated also in a venture capital funding called C Lab Ventures, which was dedicated especially for cancer solutions and for oncology devices or other solutions from startups. So the next one, and for a future, if you can just press next and you'll show the all. Yeah, in the future we are going to get CE marking, which is a bit delayed due to all these COVID procedures, and then enter Baltic markets with the first adopters from Lithuania, Estonia, and then French market, scale to French market, German, and later to United Kingdom. And while the Estonian non-governmental organization mentioned that they make the race of the ducks, so we as an oncology startup, we usually feel like that black duck among all the white ones, which is presenting very fancy, illuminating things, and we are the ones who are showing the pain and the suffer of the patient and the doctor. So I believe we can work together, network together, bring this more brighter than it really is. So the next slide is the final one. So we have a mission in our startup to develop the best possible treatment for every patient and to devote it for every hospital. And we always invite others to be a part of it, to be a partner, and to just to bring the impact for 200 million cancer patients. Thank you.
Thank you very much for this presentation. And I am just informed that we have one more speaker from Latvia. Mr. Helmut Spekis from Latvian NGO Onco Alliance, and he will say just briefly a few words from Latvia, please.
Hello for everyone. It's nice to be here. Yeah, I didn't prepare a presentation, but we are like Onco Alliance. We are the umbrella of all oncology patient organizations here. We are the ones who are giving the question. If somebody is speaking about the patients, we asking where we was when the question was in the beginning. We are the ones which were giving the question to our government, where is this plan of oncology? So we didn't get a big one, but we get in short term the plan. We are the organization which are we are really strong in patient advocacy in national level. We are just 1 year old, not even 1 year. We are just some couple of months, but we already made a lot of things happen here. But why we are everyone will know what Onco Alliance is, because the next year in March in Riga, we will make a congress about the quality of cancer treatment in Europe. So very welcome to join. And there we speak about these qualities, because when the Lithuania is speaking, it's good to hear that they are our neighbor country. And only country who is living worst in Baltics are Latvia. So Neringa already showed you the numbers. Our numbers are even worse. So it's nice to be here. We will be prepared to get these all your documents work in Latvia together with Professor Leia. We will study, grow strong, and will protect our 80,000 oncology patients in Latvia, and collaborating with Lithuanians and Estonians will do a lot of good things here. Thank you very much.
Thank you. Great words for the ending of this conference. And this will conclude our webinar on Conquering Cancer, Mission Possible, Coordination of Actions in Baltic States. Again, this event was organized by the Research Council of Lithuania, National Contact Points, and Lithuanian RDI Liaison Office, LINO, in Brussels, with also Latvian and Estonian RDI Liaison Offices in Brussels. And this discussion was streamed and also recorded, so you can watch it again online at the Lithuanian RDI Liaison Office LINO YouTube channel. The presentations and all useful links will be shared afterwards also with you. My name is Neeme Raud. I'm an Estonian journalist, and I was hosting this discussion today from Tallinn. And the only thing I have left to say to you is thank you for participation. Be safe. The COVID is still here. And I wish you from Tallinn a good day.